It's official. Per a memo sent out yesterday by Attorney General Jeff Sessions, federal prosecutors are being told by the Trump administration to consider every tool to combat the opioid epidemic, including capital punishment, the death penalty for drug dealers in certain cases. The move may be legal under a 1994 law signed by Bill Clinton, but never used, something Donald Trump said was time to change when he was in New Hampshire earlier this week.
If we don't get tough on the drug dealers, we're wasting our time. And that toughness includes the death penalty.
Trump also promised to increase access to drug treatment centers by lifting a current Medicaid limit. And in that same speech said his border wall will help cut down on drug trafficking and that certain cities are to blame for making the opioid problem worse.
As the people of New Hampshire have learned firsthand, ending sanctuary cities is crucial to stopping the drug addiction crisis. In Boston, Massachusetts, which is a place where you have sanctuary cities, I'm repeating my call on Congress to block funds for sanctuary cities and to close the deadly loopholes that allow criminals back into our country and into our country in the first place.
So is this where we should be focusing our attention in fighting the opioid crisis? I'm joined by Michael Botticelli. Michael's the former White House Drug Czar under Barack Obama. He's now executive director of the Graken Center for Addiction Medicine at Boston Medical Center. Michael, it's great to see you.
Good to be with you, Jim.
We start big picture and then we'll go into some of the details. Trump got it right the other day in New Hampshire or no?
So first and foremost, I'm trying to be objective when I look at this. And so from my standpoint, it's not much of a plan. Right. So the administration has been in charge for 14 months now. And, you know, when you have a plan, you have clear deliverables and you have measures. So this seemed to be pretty disjointed to me in terms of kind of how they're approaching this.
How about some of the elements, though?
So let's talk about some of the elements. I think, you know, if you listen to the president, if you saw the announcement, the overriding narrative in terms of their approach to this was really kind of going at kind of supply reduction, building the border wall. Let's get tough again on kind of drug traffickers and users. I mean, even to the point of, you know, promoting death penalties. And I think we've seen in through the recent history of this country that over-reliance on supply reduction and law enforcement, and not to say that there's not a role for it, has not gotten us anyplace. And I think we've come to acknowledge that this is a significant health issue and that we really need to lean into the health approaches to this issue and really move away from kind of overly harsh criminal penalties.
Yeah, it's funny you say it. Someone who knows a lot about this said to me recently that given who voted for Donald Trump, you'd think that that's exactly the direction in which he would go. Do you agree with that?
I absolutely do. So if you look at parts of the country, and even at a county level, counties who've been dramatically impacted by the opioid epidemic overwhelmingly voted for Donald Trump. So this would actually be a perfect place for him to reach out with a level of care and compassion to deal with the issue.
Let me stay on a couple other elements. The sanctuary city thing. You not only mentioned Boston, you mentioned Lawrence. That's part of the problem. I assume the notion is these city governments are shielding horrible drug dealers. Is there any merit to that?
Not to the best of my knowledge. I've never seen any reporting or intelligence that would lead anybody to believe that that is really the case here. It seemed like he was conflating two dramatically different issues here. As I mean,
his immigration issue and
Correct.
His opioid thing, and that, you know, with almost everything, I don't know if you agree, money is. Follow the money, and you can find out. Charlie Baker, who cares a lot, I think it's fair to say cares a lot about this,
Correct.
is on the President's Commission on Opioids and chaired by Chris Christie. I asked him the other day, well, you'll hear what I asked him and hear what the governor said. Here he is. So you think Trump has a serious commitment to this?
You put a lot of money on the table. There's billions and billions of dollars.
And as soon as that segment was over, we got flooded with emails saying, yeah, he is putting billions and billions of dollars on the table in new funding, but he's taking away billions and billions of dollars through Medicaid cuts, which are the chief source of funding for addiction treatment. So where does the truth lie?
So I think part of this, and I do have to say that as I've seen announcements in terms of the new additional money that's coming to places like Massachusetts, that was actually money that was championed by President Obama and passed by Congress that's now finally coming out to states, right? So I do, while there's additional dollars coming out under the Trump administration, these are not new dollars that the Trump administration.
But they are dollars.
But they are dollars, and they are really important to do that.
How about the Medicaid offset? Is that a concern?
Well, so here, it is a significant concern, and I think that, it was very interesting to me that part of the kind of main plank of this plan that focused on expanding treatment was to ask Congress to remove this decades-old Medicaid rule in terms of increasing access to treatment. But I do think it's kind of worth noting that, while he's right in understanding the role that Medicaid plays, this was also an administration that really championed dismantling the Affordable Care Act and Medicaid. And so I do think it's a little bit hypocritical to lean into Medicaid now at a time, so is this going to mean that he's not going to call for the repeal and replacement of the Affordable Care Act? Is he going to now basically ask governors to expand Medicaid? Which
I can answer that for you.
I think we know the answer to it. But again, there are really no new resources that I saw other than those that had been already dedicated to this issue.
So if Kellyanne Conway, who I guess is the drug czar, is that what she is?
My understanding is she's leading the administration's point person on opioids.
She calls you on the phone tomorrow and says, I heard you say what we're not getting right. What should we be doing? What are the 2 or 3 things that are affordable? Because we're not going to break the budget over this, because that's what we really care about, except for the military. What do you tell Conway?
So, and again, some of these issues I think the president put forward here, right? So one of the areas that we have known to be effective is the more widespread distribution of this really incredible overdose reversing drug called naloxone. Unfortunately, many of the manufacturers have chosen to raise the price of those, and it's become very expensive. So I think one of the things that they talked about, I didn't see any resources on the table, would really to be expanding state-level resources and local-level resources to make sure that every first responder, that anybody who's in a position to reverse an overdose has access to this drug.
How about beds?
And it's not just bed capacity here, I think, because part of what we've seen is around also access to good outpatient treatment programs that offer medications. One of the things that the president has the authority to do, and his departments, is we know that we have these great medications that are highly effective for the treatment of people who are addicted to opioids. But we also know that many programs throughout the country who get federal funding don't offer these medications. So one of the simple things that they could have done was to require every program that receives a federal dollar, if you're a drug court, if you're an addiction treatment program, to offer access to these medications. We've seen here in Massachusetts that has dramatically reduced overdose deaths.
We only have 30 seconds left. It seems to me, to return to almost the first thing you said, Michael, the most important thing is a mindset change, a la the Gloucester program, that this is a public health problem, not a public safety problem for the most part. Hasn't that got to be at the center of anything that's going to work, or no?
We do. I think the overall approach has got to be this is a public health issue. And I do think it warrants mentioning that many national, state, local law enforcement officers get that. Yeah. The biggest single request I got from law enforcement officers was more treatment capacity, not more drug task forces, not more officers.
I'm glad to hear that, Michael. Great to see you.
Great.
Michael
Good to see you
Botticelli.
too.
Really appreciate your time.
Jim.
Thanks so much.